Good evening. I'd like to call this regular board business meeting to order and ask the treasurer to call the roll.
President Baker.
Present.
Mr. Brown.
Here.
Vice President Cole.
Here.
Ms. Gibbs.
Here.
Ms. Hudson.
Here.
Mr. Peretti. Here. Ms. Reyes.
Here.
You have a quorum, Mr. President.
Thank you very much, Mr. Treasurer, and I'd like to ask Board Member Reyes to lead us in the Pledge of Allegiance this evening.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, now allow me briefly to read through our agenda so we are all aware of the work we have before us this evening. The board will adopt the agenda shortly. We will then take public comment if we have any this evening. We will then have a brief recognition of Women's History Month led by Board Member Gibbs. We will then hear a report from the superintendent, after which we will take up our consent agenda. Following that, we will take any announcements or points of pride board members would like to share. We will adjourn. After that, we will not have an executive session this evening. So having said that, the chair will now entertain a motion that we adopt the agenda as presented.
So moved.
Second.
Moved and seconded. Mr. Treasurer?
President Baker.
Yes. Yes.
Oh, I'm sorry, I didn't hear you. My apologies, I didn't hear you. Mr. Brown.
Yes.
Vice President Cole.
Yes.
Ms. Gibbs.
Yes.
Ms. Hudson.
Yes.
Mr. Peretti.
Yes.
Ms. Reyes.
Yes.
Motion carried.
Thank you very much. So again, welcome everyone. Want to mention briefly the state of the city last week. It was wonderful to have that event hosted at one of our high schools. Very excited about that. I don't know if Columbus has ever had a mayor in the past that was both a CCS grad and a former member of the Columbus Board of Education. So I'm very excited about that. And also wanted to let you know that there, board members, there's a sign-up sheet going around for high school graduation speeches. So please do sign up for a few of those. We do not actually have any speakers who have signed up to speak this evening, so I'd like to call on Ms. Gibbs to lead us in a recognition of Women's History Month. Ms. Gibbs?
Thank you so much. President Baker, Vice President Cole, members of the board, it is a privilege and an honor to take a few moments to recognize Women's History Month. And in the research of this momentous occasion, what I found in our studies is that Women's History Month dates back to International Women's Day in 1911, but in 1978, the school district of Sonoma, California participated in Women's History Week. And it was an event designed around the week of March 8th, which was the International Women's Day. In 1979, they held a conference at Sarah Lawrence College to study all of the impact and contributions of women around the world. And it was sponsored by Sarah Lawrence, the Women's Action Alliance, and the Smithsonian Institution. And you'll hear about the significance of the Smithsonian in the lives of women later on tonight. When the participants in the conference learned of what the school district in Sonoma, California had done and the success of their event, they decided that they would support an effort to secure a national recognition for Women's History Week. In 1980, President Carter issued a presidential proclamation declaring March 8th as Women's History Week, and by 1988, every president after Jimmy Carter has designated March as Women's History Month. And state departments of education around the country celebrate Women's History Month by making sure there is proper curriculum in their districts and in the classroom that celebrate women and their contributions to equality, such as Susan B. Anthony, Harriet Tubman, Sojourner Truth, Lucy Stone, Lucretia Mott, Elizabeth Cady Stanton, Harriet Tubman, and Alice Paul. So today, to celebrate our Women's History Month, we have two amazing young ladies. The first one we are going to hear from is Miss Julia Currian. She is a junior at Northland High School, and she is one of our student ambassadors. She is joined today by her principal, Mr. Jason Johnson. Miss Julia.
Good evening, President Baker, members of the board, and Superintendent Good. I am Julie Korean, and I am a proud junior at Northland High School, home of the Vikings. I am here today to express to you my views on the importance of Women's History Month, which is celebrated in the month of March. Women's History Month means more than just a month to me because it represents who I am, where I come from, and where I'm going. My mother, Mrs. Jamal Korean, is a full-time registered nurse who raises me and my brother. She taught me to be independent and always chase after my dreams. My mother amazes me when I see her never-ending care for her patients and all while raising her family. Women's History Month also encourages me to celebrate another impactful woman in my life, Dr. Sybil Brown, a teacher and the STEM Club advisor at Northland. As a teacher and a mentor, she taught me that my future will always be bright as long as I focus on the light at the end of the tunnel. She finds the best in every student and is a constant motivation. And lastly, Women's History Month allows me to honor my mentor, Mrs. Michelle Kroll, a lawyer at the DSW warehouse. She is helping me through my high school career and taught me to always remember who I am and to embrace all my flaws so I can be the best possible me. All these women have contributed immensely to my life, and I feel that all students should have access to outstanding women just like these to help them through all their journeys in life. It means a lot to me to stand here and speak to you guys about the significance of Women's History Month. Because even though women have always made tremendous contributions in our society, they have not always been recognized for their contributions. And I am proud to be a Columbus City School student because in this district, we represent women, honor women, and celebrate their importance in our lives and society and the world. Thank you for your time and happy Women's History Month.
And next, coming to the microphone, is Ms. Tykia Wright. She is a member of the White House Commission on African American Excellence, the Executive Director of White Choice, a 2016 Woman of Achievement honoree by YWCA, a member of the Alumni Board of Wright State University, and a very proud alumni of Mifflin High School.
Good evening.
Give it up for Tykia.
Well, good evening, everyone. Good evening, President Baker, and all the members of the board and Superintendent Good. Thank you, Board Member Shauna Gibbs, for that introduction. You know, it has been an exciting opportunity to serve in all of those capacities that Shauna mentioned, but my proudest of all of those mentioned was being a 1995 graduate of Mifflin High School. You know, when I look back over my educational career, that's where my leadership began to take shape, right? When I think about my role in Women's History Month, and I think about how that is significant to Columbus City Schools, when I was in high school, I was always that type of student who just inserted myself in areas and communities where there weren't many people that looked like me. And being in high school, there was no different. When I was at Mifflin, I wanted to be a cheerleader. And, you know, all those around me kind of questioned, well, how will she do that? How will that happen? But in my mind, it was just a matter of doing it. So in 1993, I decided to try out for the varsity cheerleading team. And, you know, the administration, they didn't know what to do. You know, my friends and family didn't know what to do. The busing system in Columbus City Schools certainly didn't know what to do. But I soon found out that behind the scenes, everyone was figuring out how they were going to make it work. And they did just that. So that was my first year. I was a proud member of the Mifflin High School Punchers varsity cheerleading team and went on my senior year to become a co-captain of the varsity cheerleading team. So that is my contribution to Women's History Month and to the history of Columbus City Schools. So in addition to talking about Women's History Month, I want to share a phenomenal opportunity to celebrate Women's History Month right here in the city of Columbus. Being a commissioner for the White House Initiative on Educational Excellence for African Americans, I also have the opportunity to be the co-chair of the African American Women's Lead Initiative. And through that initiative, we are getting around the goal for Women's History Month in the Smithsonian Institute, which Shauna mentioned earlier. Museum Day Live is an event that will take place on March the 12th. And this event is something that the Smithsonian Institute sponsors every year. But this year, they are doing a special edition for Women's History Month. And it is centered around inspiring women and girls of color. So, of course, with this being a national effort, we had to make sure that Central Ohio made some noise around this national effort, right? So the last month, I reached out to my great friend, Board Member Shauna Gibbs, and we have been rallying up the troops across the community. And we are proud to announce that our partners for this event is the Columbus Museum of Arts, as well as CCAD, Columbus College of Art and Design. And we are excited that that Saturday will be filled with just a day of exposing our young women and girls of color to opportunities to explore the arts. And it'll start in the morning at the Columbus Museum of Arts with the kickoff session. And we will spend the day exploring the museum. And that's traditionally a space where we have not been, right? So we want to expose our young girls to what the museum has to offer. Then in the afternoon, we'll transition to CCAD and kind of add an educational component to it. And there we will have workshops and performances, and we're excited to get some of the students from Columbus City Schools involved. So that day, we encourage everyone to come out, bring a sister, bring a friend, bring an aunt, bring a neighbor, so that we can celebrate Women's History Month and be a part of the national movement that the Smithsonian Institute is pushing, and that we at the White House Initiative for Educational Excellence for African Americans is championing as well. So I also brought along with me a clip so that you can hear firsthand from our First Lady, Michelle Obama, and what she has to say about Women's History Month, as well as Museum Day Live.
Hello, everyone. I am so thrilled to join you in celebrating Museum Day, because America's museums, libraries, zoos, and aquariums are truly national treasures. There are cultural town squares and learning centers, places where we can be inspired by scientific discoveries, great works of art, and artifacts from our history. But we also know that many young people feel like they don't belong in places like these. They may look at a museum and think to themselves, well, that's not a place for someone who looks like me or someone who comes from my neighborhood. But of course, that's not true. Our museums are for everyone. And I want all our young people to understand that their story is part of the great American story. So I'm thrilled that as part of Women's History Month for this year's Museum Day, the Smithsonian Institute is launching a campaign to reach out to girls and young women of color and inspire them to discover the arts and sciences. They're working with local schools, businesses, organizations, and girls themselves to create exciting programming and events. And together, they're inspiring young people across America to dream bigger and reach higher for themselves and for their country. So I want to express my gratitude to everyone who's been a part of this effort. And I hope you all have a wonderful Museum Day. Thanks so much.
Thank you.
Thank you very much, Julia. Thank you very much, Taikia. And that concludes our recognition.
Thank you, Ms. Gibbs. Thank you very much for helping to lead us through that this evening. Any questions or comments from board members?
Yes, quickly.
Mr. Vice President?
What time does Museum Day start?
Museum Day Live starts at 10 a.m. and they will be at the Columbus Museum of Art from 10 a.m. to 1 p.m. and then the Columbus College of Art and Design from 2 p.m. to 5 p.m. And the big part of Smithsonian Museum Day Live is that the Columbus Museum of Art is free all day for anyone, not just people of color, for anyone. So on Saturday, the goal as a nation in its 10th year has always been to increase access to the museum. And so there's no admission, but the special programming will be from 10 to 1 at the museum and from 2 to 5 at Columbus College of Art and Design. And there's a huge panel. Miss Diana Pagan from Festival Latina is going to be there, and there's going to be a day full of multicultural activities and dancing student performances and educational workshops. And the admissions department of Columbus College of Art and Design will be on hand to talk to parents and students about recognizing their talent and how to take it to a collegiate level.
Excellent. Thank you very much. Sounds like an outstanding opportunity for our
You want to
students.
give them? Are they still here?
And Ms. Wright and Ms. Curran, if you could come up, we do have a
Go ahead.
Columbus Proud sticker for each one of you.
Board Member Peretti is going to give
Board
you a
Member
Columbus
Peretti.
Proud sticker.
We'll present those to you.
Yeah. All right.
Thank you both very much for being here this evening.
One more round of applause.
All right, thank you, Ms. Gibbs. Thank you, board members. And let's now move on to our superintendent report. Mr. Superintendent, the floor is yours.
Thank you, President Baker, Vice President Cole, members of the board. At the State of Our District event back in January, I shared with all of our families, staff, and supporters that the state of our district is one of growing student achievement, powered by a commitment to innovation in what we do and a restored faith for how we do it. And over the past 2 weeks since this board last met, we've seen example after example, once again, that proves this to be true. Most notably was the Ohio Department of Education's release of the second half of the 2015 local school report card. Our district earned an A in overall progress for all students in math and reading for grades 4 through 8. And you compare that to last year when the district score was an F on that section, I think that's worthy of applause. If you aren't familiar, this progress section of the report card looks at value added and measures just how much students grow and learn each year. In addition to our district's overall A in progress or value added, 50 of our 94 elementary and middle schools also earned an A or a B, which means that those students are averaging more than a year's worth of growth in math and reading. And just to note, our high schools are not scored on this measure, so those schools aren't included in the progress report. The score highlights the commitment of our teams, particularly our academic teams, from teachers and instructional assistants in the classroom to the principals and administrators in the offices, everyone that's providing valuable curriculum and instruction that helps all students grow every year. And there's more good news. The report card shows A's and B's and how we are helping students who need extra attention. Our gifted students, our students in the lowest 20% of achievement, and our students with disabilities, all achieving an A or B. In fact, the Ohio Department of Education credits the district for its improved efforts to identify and serve all of our gifted students and ensure they achieve real academic growth each year. Now, make no mistake, there are other scores on the report card that reveal we still have much work to do, but I believe it's worth the recognition by ODE of the value we provide to our students and families in Columbus City schools. Our district has also been recognized for the number of students taking advantage of innovative new career technical offerings. At a recent event with President Baker, Kids Ohio released its latest report showing roughly 28% of our junior and seniors, that's more than 1 in 4 students, are taking a career tech course. Our innovative programs have become the gateways to skilled positions in the construction trades, healthcare, and information technology. The Kids Ohio report shows that our students graduate with valuable skills, college credit, and industry certification, and often with a job already in hand. And we have made the pledge to double the number of students taking these valuable career tech courses over the next 5 years, and we are well on our way to accomplishing that goal. We've also been recognized for how we focus on the whole needs of our students. Just yesterday, the Children's Hunger Alliance recognized our district as the 2015 School Breakfast Program of the Year. We have one of the highest school breakfast participation rates among all Ohio districts. We served more than 4 million breakfast meals this past year to students and all, free of charge, regardless of their income. And for that, we applaud our staff at all levels being committed to the nutritional well-being of our students, and a special shout out to the more than 400 dedicated employees who cook, pack, deliver, and serve meals to our students. Some of our students also need the advice and support of caring adult mentors to be successful. A week and a half ago, the Acting Secretary of Education officially announced the launch of the Success Mentors effort, all part of the President's My Brother's Keeper initiative. As you know, Columbus City Schools is one of just 10 districts nationwide that were invited to participate in this effort because of our commitment to mentoring and the innovative approaches we are taking. In fact, if you were watching on the day of the announcement, the White House used a picture from our mentoring effort at Sherwood Middle School to promote the whole program. Next, and another point I shared at the State of the District, we know that many of our students miss class time because of their health. We've already launched the first phases of our Care Connection partnership with Nationwide Children's Hospital, which places nurse practitioners and behavioral health professionals from Nationwide Children's Hospital in several of our Southside schools. Tonight, I want to share with the board the next step in our innovative efforts to provide the much-needed health care opportunities for our students. So I'm going to invite Kate King, our Director of Health, Family, and Community Services, to come to the podium to talk about two new partnerships that will be the foundation of our school-based health center initiative. The goal is simple: to give our students greater access to vision, dental, primary care, and mental health services. And Kate will lay out the undertaking for how we're going to get there. Kate?
Great. Thank you for having me. Thank you, President Baker, Vice President Cole, and members of the board. I have a dream and a vision, and I'd like to introduce some of my fellow dreamers, my community partners who have been working with me to make this dream a reality. I have Lisa Kirkarudo. She is the administrator of the School Vision Program for One Site Luxottica. I have Dr. Michael Early from the OSU School of Optometry and the Ohio Optometric Association, and Mr. Reed Fraley, who's the Chief Operating Officer of PRIMARYONE Healthcare, formerly known as Columbus Neighborhood Health Centers. So school-based health centers are a powerful investment in the health and academic potential of our children and adolescents. So today I'm here to talk about a proposal for a centralized clinic. A centralized clinic, as Dr. Good said, that combines optometry, dental, primary, and mental health services. So let me back up and talk about our history a little bit. We've been working on this for about 3 years, maybe a little more. And we currently partner with over 49 agencies to provide health care for our Columbus City School students, most of the time on school sites. And as Dr. Good mentioned, our Care Connections project is moving forward, and we're very grateful to Nationwide Children's Hospital for that. But we still have never provided a full contingent of services on one site. So about our students, we need to close that gap. What do our students need? Our students need vision services, dental services, immunizations, primary healthcare services such as well-child physicals, acute and chronic disease management and treatment services, and mental health services. Vision care. Students who can't see can't learn. And that seems pretty simple, but I really need people to understand that. So when you look at this slide, this is how I see everything without my glasses. I can read it, and you can probably read it. But think if that's how you had to read all the time. How long would you read? How long could you read? And how much interest would you really take in reading? We have great children in Columbus City Schools, but even they give up after a little while. So over 3,000 vision referrals were made by our school nurses last school year. We changed the screening timeline last school year. We used to screen third graders in February or March for vision, hearing, a number of other things. But with the third grade reading guarantee, we felt in health services that it was so important that we get glasses on children's faces so they could learn before it was time to take their tests. We changed that. We now screen third graders and make referrals in October so that they can see, to learn to read, to be able to pass that. And last year, 87% of our third graders matriculated to fourth grade. Is that a coincidence? I think not. Now, I'm going to say there are a myriad of variables that got us to there, and I want to give credit to everyone, our staff and our teachers and our administration, but I'd like the school nurses to get some credit for contributing to that percentage and what we're doing well. But to borrow from Alicia Gillison, there's always more. Dental services. This child's teeth, this is not unusual. We see teeth like this as school nurses all the time, unfortunately, when we do dental screenings. This is heartbreaking to see. We referred over 2,500 referrals for students. Dental services and dental exams are required for our pre-K and special needs preschool kids to be admitted to our program. Oral health needs are increasing, and this is maybe surprising to you. On average, students miss about 2 days of school every year because of dental concerns. Most people really don't think about that, but they do. However, there's always more. We need immunizations. So we got a little guy with mumps here. Pre-K and special need pre-K students need immunizations, again, to attend, to even start our program. Our ESL population, and that's measles, schmeasles, I just like to say that, but measles is a horrible disease. Many times they come to our country without their full spate of immunizations, and they need to catch up. We want children to be immunized in school, not because it's the law, although we do want that and we want to follow the law. It's to keep them safe and to keep everybody healthy. And then our K-12 students also, by law, are required to have mandated immunizations. And again, wouldn't it be nice if we never had to exclude any child because they hadn't received their immunizations? Love to see that. We need primary care, physicals, and well care. Again, pre-K and special needs preschool students have to have a physical exam before they can enter our program. And here's a little teaser for later, but I'm really looking at a site right next to our Central Enrollment Center. And wouldn't it be great if they could come and have their pre-K screening and then just go right over and get their physical and get their dental exam, and they'd be ready to go, maybe even a few immunizations, rather than their parents having to go place to place and maybe forgetting or maybe not being able to do that and delaying their entry into our pre-K program. And of course, we always need sports physicals. We know how important extracurriculars are to our students. Sometimes it's the only thing that's keeping them in school. I'd hate to think that just because they couldn't or didn't get a sports physical would keep them from participating and therefore continuing their school education. We need acute and chronic care, earaches, asthma, diabetes, just to name a few, but there's always more. Mental health services are so needed for our children in Columbus City schools. We see them all the time, and what we really see are a lack of access to services. Now we're really expanding. We're partnering with several agencies again to provide these mental health services, but there's such a huge need that we still don't have that full contingent for them. Let's talk a little bit about our barriers. So for parents in receiving health care, transportation to healthcare providers can in and of itself be a barrier. If you have only budgeted for gas to get to and from work, you don't have gas to take your kiddo to the doctor. Many times they have to take off of work without pay. Some of us who have wonderful jobs forget that people don't have sick time in many jobs, and so they don't get paid when they take their child out of school. Many of our parents have a lack of knowledge of how to access or utilize the healthcare system, and lack of timely appointments in many clinics really put a wrench in them being able to keep an appointment. If you make an appointment 3 months out and you are really living in a high-stress situation, remembering that appointment and getting there is nearly impossible. And for our students. So many students who go to an appointment miss an entire day of school. Now I'm going to say many of them probably want to, but we don't want them to. And sometimes it gets back to that transportation issue that parents only have the time or the resources to get them to that appointment today, not to school and then to the appointment and then back to school. We have students having absences for treatable or preventable diseases, decreased ability to learn due to lack of classes or eye care. We need to give them easy access to sports physicals, as I mentioned, and then they're excluded by law sometimes due to lack of mandatory requirements, such as those pre-K physicals and dental exams and immunizations. So we looked at preliminary planning. Actually, we had a field trip to the Euler School in Cincinnati. The Euler School started with an optometry clinic and moved forward from there, and we did some fact gathering. And they have a wonderful service. They started with optometry, they added dental, they have basic primary care and basic mental health. It's a great thing. But I think we can do it and even do it better because we want to be the best in Columbus City Schools as always. So I started meeting with PRIMARYONE Health, just to remind you that's formerly the Columbus Neighborhood Health Centers, in one site to see what the feasibility was for this kind of partnership. We did a survey of possible sites, and as I said, we've really settled on the garage. It's a 4-bay garage. If you've ever seen it, right next to Central Enrollment, it's perfect. We explored an optometry clinic funded by one site, and they do this all over the world. They have clinics in New York City, in Gambia, California. We explored the possibility of services provided by PRIMARYONE Health and a possible lease agreement. So we tried to do all this groundwork for the clinic before we presented anything. So now we get into the nitty-gritty, which is funding. So there is a precedence for capital funding needs for school-based health centers to be satisfied through philanthropy, grants, or other mechanisms. And that is from a study done in 2012 by the Osteopathic Heritage Foundation and Columbus Foundation and Columbus City Schools, looking at school-based health centers. So there's money out there. I want to show you the cost estimate. So the cost estimate total for this clinic would be roughly $2.6 million. We're looking that our partners are willing to put in a large sum of money for this, or resources. So $400,000 from Untitled Chapter. PRIMARYONE Health is willing to outfit the other clinics other than optometry and provide staffing. We would be looking at doing the renovation of the building either through community fundraising or capital funding, as well as transportation for those students. Let's talk a little bit about one site. So one site, Luxottica, would provide $400,000 for state-of-the-art equipment for vision exams and treatment, glasses selection and fitting, glasses repair, which is so important. I am an expert in glasses repair as a school nurse. I am, but I'm not as good as an optician. I just do my best, and so do all the school nurses who work for me. Glasses for students with no insurance. They'll provide an optometrist salary for 2 years and an optician salary for 2 years. And let me tell you the wonderful thing, there's many wonderful things, but one wonderful thing about this clinic is kids come in, they get their exam, we can provide them lunch, they go back to their school. When their glasses come in, most of the time with our services, they get shipped to the school and the kid puts them on. What happens in this clinic is the optician goes to the school, so that child doesn't have to come back to the clinic, takes the glasses, takes the fitting tools, goes out, calls them out of class for a minute, puts those glasses on, makes sure they are the right glasses and they fit perfectly. And that is such a great service, just one of the wonderful things that one site can do for us. PRIMARYONE Health, formerly the Columbus Neighborhood Health Centers, are an established FQHC system that provide all of these services somewhere around the city in their clinics. Now, what Euler learned through their optometry clinic is that they were not an FQHC, a federally qualified health center, and in order to be sustainable, that's what has to happen. So we have this gem, PRIMARYONE Health, here in our city already doing all of these things. So we don't have to start from square one like Euler does. We have someone who's willing to help us and willing to do it. We need to take advantage of this. So they are willing to operate the health center, be responsible for the fiscal soundness of the operation, lease the required space, provide the staffing segments, and provide the appropriate equipment. We're very glad to have them. We have never partnered with them through Columbus City Schools. I do not know why, but I think it's about time we started. So my vision is a vision clinic and more, but my vision is that school-based health clinics will improve the health and well-being of Columbus City Schools students, families, and communities by increasing access and utilization of health care. We want to look at improved attendance, academic achievement, graduation rates, increased enrollment, and national benchmark establishment. There are some mandatory criteria that we want to be sure we satisfy, and that all services are available to all students regardless of ability to pay, and that has been agreed to by PRIMARYONE. Actually, they do that anyway, but it's specifically to make sure that you all know that. And healthcare services must achieve a self-sustainability without additional cost to the district. We need a reliable transportation system for students. So what the Oilers started out doing, they had a donated van, and they used AmeriCorps volunteers to drive and staff. Just recently, they have changed that system, and I've talked a little bit actually to Lisa about that, and I think we need to look at some different options for that transportation, but I think that's a you build it, they will come kind of thing. We'll make sure students get there. And I do want to be clear about what the clinics will do. So the first phase is support for the clinic, and I presented to senior leadership and had just a wonderful supportive environment there. Everyone thought it was a good idea, I'll just say it. And now I'm presenting to you to see what you think about it and your support. We need to look at fundraising or the money to renovate. Then we would need to look at the construction remodel and the clinic implementation. So to be clear, our phase 1 would be the optometry clinic. Phase 2 would be the dental clinic. And then the primary care and mental health clinic would be basic services. So I just want to be clear that the original vision would be immunizations, some physicals, well child, and mental health. It wouldn't be a crisis center. Like if someone were, a kiddo of ours was suicidal, we would send them to our centers, OSU or Nationwide Children's, for what they do the best. But this would be some basic services and referrals in mental health. So our goals are not this, aren't those teeth, and look at that boy trying to read and a bad report card, but we want this. So I thank you for your attention. I'd be happy to answer any questions, and I'm going to invite my guests up to the podium in case you have any questions for them. So come on up.
Thank you, Director King. Are there questions or comments from board members on the presentation? Yes, Mr. Peretti?
I just want to first say thank you. I really appreciate this presentation and really happy that our district is moving in this direction. I did have a few questions, revolving around some of the services and that delivery, but I first wanted to actually go into sort of the brick and mortar aspect of it, and was just looking forward as we move forward with our facilities master plan and working with the community to create that. I'm hoping that we as a board and our ad hoc committee fully vetted to this and see this in our options and really look forward to that. So that being said, I was sort of curious, what are some of the barriers when it comes to a lot of our students using this third aspect of it, sort of the healthcare aspect of it, the regular preventive care? Like, how could you have students sort of this being to our students sort of their sort of annual preventative care sort of care delivery model? Like, how does that make sense? Like, what are the sort of the barriers for that? Like, is that something that districts do, and like where students use this as their preventative care sort of primary physician? I'm trying to say.
So President Baker, Board Member Peretti, I think I understand what you mean. So our littler children get preventative care because they need immunizations, and parents seem to be more involved. And we see as students move onward in their education, especially when we get to adolescence, they don't do preventative care. They don't see the doctor. We're looking at some new immunizations being required, but they don't, because there's no mandate to, except for sports physicals, to get that done. So some of the barriers are just thought process and not understanding that that is so important. Again, the barriers I mentioned of transportation, and parents being able to take off work and navigating that health system. So we want to encourage that, and we want to make the access much easier for parents. And I think if we provide a better access, and also if through our transportation, we take children during the school day to see and get that preventative care and bring them right back to school, we do both things. We get them the care and they don't miss a whole lot of school. And we do know that when they get preventative care, we find things early that we can treat and do something about rather than waiting till they're very ill. Does that answer your question?
Other questions or comments? Yes, Ms. Reyes?
Thank you very much for your presentation. I was sharing with Board Member Hudson that as a board, we discussed this about 7 years ago from the Fort Hays site to see if that would be something that would be possible. 7 years is a long time, but it's nice that it's finally here. So when you're talking about having our children having access to these appointments, where are the parents going? One list was saying that the parents didn't have to come, but I'm assuming some parents do want to come. So how do we adjust for that, for the parents to attend?
So President Baker, Board Member Reyes, parents certainly would always be welcome. If they can bring their children there at the time, that could be something. It's a good question because I really have not explored whether parents could come to the school and get on the transportation with students. So that's an excellent question, and that's something I think I do need to explore because parents would like to be there for most of those. So thank you for that question, and I'll look into that and get back with you on
Especially
that.
if they're getting dental work.
So it's, if I may, President Baker, and it's a good question. I looked back at our acting transportation director, and he indicated no, a parent would not be able to do that. But given we're the largest district in the state, again, this is an opportunity for us to seek some relief through legislation and perhaps provide waivers, because we do know that this is a model the state is interested in seeing replicated at many districts across Ohio. And so given that we're the largest district, if we can make it work, probably other districts could as well. And so there's the possibility that those challenges, those barriers, may be ones that we can take care of.
Thank you. We would certainly work on that.
So that does bring me to the transportation issue, because I work with this community outside of Columbus City Schools, and I have folks that have to pay CODA if they're disabled. Do we have a CODA bus stop in front of this potential site?
Yes.
So I know that many nonprofit organizations do have difficulties with the transportation piece. Lower Lights, some of the other community partners that are around here, so I'd be interested to see if that's a viable option.
Can I?
Go ahead.
Could I speak to that? So also, new legislation has made it possible for the providing agency to bill Medicaid for transportation services. So that brings in some revenue for those transportation services to maybe offset some of those costs as well. So that's another area.
Yeah, so that brings me to the ESL population that may or may not have Medicaid. So that's what the transportation issue kind of sparks a question for me. So now going away from the transportation issue, for the ESL, so my nonprofit organization refers folks to some of our community partners, and what I later find out is when we refer them, there's nobody there to speak their language. So have you kind of discussed that and seen how that would be addressed?
So Reed, I'm going to punt this to you because they would be providing services at how that's done at PRIMARYONE right now.
That's a challenge every day for us. Yeah. I should point out that right now at PRIMARYONE Health, on any given day, self-reported is over 30% of our patients do not have English as a primary language. So we are continuing to increase and strengthen our ability to provide language assistance. That varies from trying to hire as many staff as we can who are bilingual, and our sites do have a focus based upon being neighborhood where if we have certain languages we can identify with. Our primary language challenges right now are Spanish and Somalian, and we're also seeing a growth in several other languages. We have contracts for language assistance from people we bring in under contract. And additionally, we have a computer-based audio-visual system that we tie into that gives us the option within about a half hour to have access to about 140 different languages and dialects. That doesn't mean we don't have a surprise every day, but we've made a firm commitment because we know that's a growing challenge for this community, which is so welcoming to people who speak another language. And so this is a challenge of the day. I can't commit we would not have a challenge at the moment, but in the context of, I think, the question that you're posing, it is a challenge we have every day, and we're working very hard to address it. And as I said, with 30% of our patients on a given, or during our patients, I mean, self-reported as not having English as a primary language, it is a commitment every day for us to figure out how to answer that challenge. of assistance to the patient, because it is so important not only to have the language translation, but the medical translation, which is the real key. It's not just the language, but it's the understanding of the medical terminology.
Yeah, so I love the questions because they're the right questions to ask, but keep in mind too, we process over 109 languages on a very regular basis. There are MARTI systems like the one you described that serve as interpretive services, and the proximity to central enrollment allows us to really benefit from maybe some joint investments so that we can utilize those different tools for both services. So I don't see this as a challenge, I see it as an opportunity to really create something that's replicable statewide, and therefore I think it's of great interest then likely to the Ohio Department of Education as well as the health associations and certainly to the governor's office, I would hope.
One last question, you permit me, at least for now. So some of the free clinics or free service providers out in the community are transitioning to having some of those free clinic medical professionals become primary physicians. Is that a model that you hope to have in the future? So I come to you, I don't have a doctor or a dentist or optician, so do we see a model where ultimately that provider that we have in the clinic could be their primary medical professional?
So President Baker, Board Member Reyes, yes, we do. And the beauty of, again, PRIMARYONE is that there are 10 satellite clinics as well. So if we bring a student in and they receive primary health services, it may be that they don't even know that that service is in their neighborhood and then could get their primary care in the neighborhood from that PRIMARYONE clinic. So that is what we're looking at, that they can be seen at any of those satellite clinics and establish that primary relationship, because a medical home is one of the most important things that we can do for our families and our students, that they trust the healthcare providers that they see, they know them, and they know what to expect.
Thank you.
Thank you, Mr. Brown, and then Board Member Hudson.
Just a couple of questions. One, very closely related to Ramona's question, and that is more specifically about notification to parents. Do you plan to have a system, even for those parents who are not able to come or don't want to come or trust the process, at least to notify them and give them that opportunity that their child is about to go or en route to the facility?
So President Baker, Board Member Brown, yes. If we think back to the shared consent form, PRIMARYONE has been involved with that and has been in meetings with us, and so we would use that same shared consent form for PRIMARYONE. Certainly, there is a room to put transportation permission on there, and then a notification after, either by phone or by a letter home to parents. So they would. Yeah, we wouldn't just put kids on the bus and take them. Certainly, we would have parent permission. And I think that shared consent form, as we expand it to our other community partners, will be so important. Great. That we can do that.
Good. The other, just, within the package of primary services, immunizations, there are quite a few things that are very important to the population of students that we serve, especially those that are coming of age, approaching adolescence, and needing immunizations for HPV, or just basic healthcare services related to their becoming adolescents and becoming active. Are we planning to include those kinds of services within the package that we'll provide?
So yes, right now the shared consent form does address those healthcare services for our adolescents. It is much needed, and that would be part of what PRIMARYONE does already. And again, we would want to offer everything we can to our students. So yes, the answer is yes.
Just from personal experience.
Correct, yeah.
Having had throat cancer a couple of years ago and now being cancer-free, I learned a great deal about the importance of HPV immunization. Mm-hmm. And both for boys, obviously, as well as for girls.
And while HPB is not required for school attendance, certainly we encourage that. And then when our healthcare providers, PRIMARYONE, Nationwide Children's, when they're providing, they don't provide vaccines just because they're mandated for school. They provide the full spate. So that is
Wonderful.
What we plan for.
Thank you.
Board Member Hudson?
Thank you, President Baker. Thank you very much. And I certainly, I think the Euler model, this is well far ahead of that. And I had a couple questions, and I just want to make sure I have the cadence right on how we're approaching this. How does this proposal work with what we're doing with Nationwide Children's and the South Side right now? Because I want to make sure we're collaborating both ways, because that's more of a regional. What I saw was, I thought that was a test to do like a regional model of regional healthcare, and I would think that we could do that even if Nationwide Children's couldn't do it in every school, but that, it would be a little closer for students. Why central versus regional, or where would there be differences? Will they not provide optical, dental? So could you clarify that a little bit first?
Sure, President Baker, Board Member Hudson. I want to say we have 52,000 children. There is plenty of need to go around, first of all, for all of our partners.
Absolutely.
Right. And so I see it as a collaborative effort. So Nationwide Children's Hospital provides a nurse practitioner clinic as well as behavioral health services in some of our schools, and we're moving on to more schools for next school year. They don't provide optometry services nor dental services. In fact, I believe we're having conversation with Nationwide Children's and PRIMARYONE and ourselves about how we can together provide all of these services. I think long gone are these are my patients and these are your patients. Yes. We really want to work together. And in an optometry clinic, the amount of equipment that you really need and the calibration, as well as a dental clinic, really is best served in a central location that doesn't have to move. Now, we do have OSU mobile dental unit that goes from school to school, but it's not available to every school, every child at every time. And so, again, this centralized location will allow us to do that for our students. That is not offered in our regional centers. The cost is, as you can see, of all this specialized equipment. Again, I'll dream as big as you want, but it might be prohibitive to do several regional centers. If we would find a need for more, I could see us looking at expansion. I'd like to just start again with a centralized, and then we'll see where we go from there.
Okay. If I can follow up. The other thing I would ask is I think, with the ad hoc, how does this work with the ad hoc? And I think it's important, given that it's about a facility renovation. I just want to make sure that this project would be aligned with and included with ad hoc. I think the ad hoc discussion and evaluation could also talk about is this the right central location and the right place? It sounds like a great recommendation, so I'm all about access to health care for folks, and I think what it seems like is that it's a model to seed a program, and then with the FQHC ability to gain reimbursement, then that would be more self-sustaining, so which would provide a lot of great services in the future for our students but I would like to see this at least aligned with the ad hoc efforts, because I think, as we do that and then look at budget, you had fundraising up there, and like fundraising, I guess what I understand or what I look at fundraising from this vantage point means bond, and it means getting community funding, and we should include that or consider how do we move that up. And then the other piece I wanted to ask is, that could take several years. So do we have a place where this could be a temporary clinic until that central facility could be constructed?
President Baker, Board Member Hudson, I certainly hope it's not several years. We really have looked at many of the sites. Part of, for example, one site, Luxottica's requirement is that it's on a campus with several schools and that it be centrally located. As far as the ad hoc committee, I'm going to let...
Wait, Nurse Kate, whose requirement is that?
So primary one of the things that they looked at is that it's central.
Okay.
So if we put something up in the Northwest, even temporarily, the transportation and the differences with that, and again, to outfit a clinic like this, I'm not sure that it would really save us all that much time. But
we are soliciting information from the public in our survey about some extra desires, including health centers. So it is part of the process going forward with the ad hoc committee already, that we are talking to the community about some things they would like to see within their facilities, and this is definitely some of those topics.
Ms. Hudson?
Well, I think that's for right now. Thank you. It's a great idea. I would just like to make sure we're aligned with the ad hoc process and the FAC process, and so that as we vet all the various numbers and plans, that this important project is part of that.
thank you, I would.
Ms. Gibbs?
Yes. So thank you so much for your presentation. Thank you for coming to the table to help with our kids. I just have a few questions. The first one is about access, along the lines of what Board Member Hudson was saying. If we bring these services to for Hayes campus, for example, what happens and how feasible is it then for students at Independence or Centennial or a Mifflin or a Briggs? How would we accommodate those students? So where it would seem somewhat central, I can see where that could be upwards to a 20 to 30 minute drive, and plus appointment time, plus time back. So are we keeping regional services and adding this? How would that play in terms of access to the program?
So President Baker, Board Member Gibbs, yes, we would keep all of the services that we have already, and this would be an enhancement and an addition to those services. Right now, again, we were looking at the Euler School, which does a great job. Their students travel much farther than ours even would for this, and so sometimes they are there for several hours. They would be at an optometry appointment, am I right, Dr. Early, for several hours anyway. And again, what I think, so all of those, almost all of our schools with a few one outlier are within a 10-mile radius. So a 20-minute drive maybe, but they would have access in the same way that everyone would. What usually happens is students, say for example, who needed vision services, there would be 15 children from Independence. The van would pick them up, take them in, they would get their exam and their eye care, get what they needed done, and take them back, which would probably be a half day or less that they would be gone from school. And then their glasses would be fitted actually at the school. So I don't see that it's a different access or a huge difference in access for any of our schools.
So approaching this project, how will you prepare, or how will you train or introduce the cultural competency component for the staff and the people that will serve our students?
So I'm going to let Reed talk about, because what we're looking at is PrimaryOne Healthcare is going to come in and provide all of those services. We're not going to provide those services within or have our staff providing the services. We will do the referrals and the transportation. But then what happens in that clinic will be through PrimaryOne.
We consider cultural competency a very key component of what we do, and we would commit to two things. One is those things that we do to continue, because that's what we do at every site. And the second thing, if there are unique things that we are not doing that would be appropriate and expected of us relative to what the public school system does, we would meet those standards also.
Okay. One more thing. I saw a very large continue. I'm going to focus on vision, optometry, and immunization. I served on the board of Prevent Blindness Ohio, so yes, I'm, as you can see, all for that. And then I heard, and mental health services. So recognizing how important mental health services are, how substantial will our offerings be? Will it be just a secondary, or tell me a little bit more about what that investment can be and what the vision of those services are? If it's not a crisis center, what benefit will that provide being in this service?
So it would provide a screening, some basic assessment, and maybe referrals to other centers. So right now, we're not looking at as a full treatment center. We are in the process of looking at that full treatment from other entities and partners. It would be more of an assessment, and if there needs to be a more rigorous or intensive treatment, that would be in partnership and referral. That's what we're looking at right now. I'm not sure that that couldn't change as well, but it would be more of a basic service.
So in this model, if everyone can come and get services and not be referred out, why would that be the only component that you can't get there? So if it's a one-stop, shouldn't it be a one-stop for everything?
So right now, we're looking at those primary care, not just immunizations, but physicals, because some of those services are offered in satellite sites from PRIMARYONE and the mental health services. That's what we would start with.
Thank you so much.
Thank you.
Other questions or comments from board members for Director King? All right. Thank you very much.
Thank you very much.
Thank you. Thank you for being here, all of you.
Kate, if you could come back to the podium, please. And I hope everyone noted that Kate always coordinates her outfits with her PowerPoint colors, and so, so I knew what color the presentation would be this evening. I do want to take a moment to recognize a member of Kate's team. So if Kim Carpenter would come to the podium, I want the board to know that Kim is truly one of our extraordinary, exemplary employees, and she exhibits the highest levels of professionalism for her role as a licensed school nurse. She's been a role model for other nurses in our district for over 20 years. I think she has some colleagues here. If you're a colleague of Kim's here to support her this evening, wave your hand or stand up. There you go, they're gonna stand. Yeah, very nice. She really is a leader among her colleagues on the West Side. She's a leader in coordinating our summer school program and scheduling nurses, and she's a school nurse mentor in our newly developed mentorship program, contributing not only to the development of the new nurses, but also to providing valuable input for other new nurse mentors. But the reason I asked her to come this evening and be recognized the board is just this past week, through a very rigorous selection process, evaluating candidates from all across this great state, Kim Carpenter was named the Ohio School Nurse of the Year for the Ohio Association of School Nurses. And so we congratulate her, and she'll be giving out complimentary inoculations and drugs after. Thank you for coming, Kim. Thank you. I would also like to mention that in the past 2 weeks, we've had a couple other staff members recognized for their work. West High School social worker Joy Hostetler was named School Social Worker of the Year by the Ohio School Social Work Association. And our Director of Student and Family Engagement, Cheryl, are you here? Stand up. Cheryl Ward. Why are you applauding? I didn't say what she got yet. So it's. But that just shows the regard our colleagues have for Cheryl Ward. But she earned the association's 2016 Friend of School Social Work Award. So congratulations, Cheryl, for that. What was her And one more, our very own Betty Hill, whom we're all familiar with because she's always come through and providing wonderful entertainment and helping us to celebrate the importance of arts education. She is our Unified Arts Coordinator. She has earned a 2016 Music Educator Award for Community Education given out by the Columbus Symphony, and she'll be recognized both at a symphony presentation and at a lovely recognition banquet, and I believe many board members are attending that. So congratulations to Betty Hill. So innovation and recognition and proof of the progress we are making to give all of our students the opportunities to grow and learn, that truly is the spirit of success in Columbus City Schools. I thank you.
Thank you, Mr. Superintendent. Any questions or comments from board members related to the superintendent's report? Thank you very much, Mr. Superintendent. You are doing a great job. Now, Mr. Treasurer, have you anything you'd like to share this evening?
I have no report.
Madam Internal Auditor, have you anything you'd like to share this evening?
Thank you, President Baker. I do not have a report this evening.
Thank you very much. At this time, we will take up the consent agenda. Is there a motion to adopt? All right, is there a second?
Second.
Moved and seconded. Is there a discussion on any particular piece of legislation within the consent agenda this evening? Board members? Any questions from board members? Seeing none. Mr. Treasurer?
Mr. Brown?
Yes.
Vice President Cole?
Yes.
Ms. Gibbs?
Yes.
Ms. Hudson?
Yes.
Mr. Peretti?
Yes.
Ms. Reyes?
Yes.
And President Baker?
Yes.
That motion carried.
Thank you very much. Mr. Superintendent, are there any employees you'd like to recognize tonight out of that agenda? Okay, thank you very much. All right, board members, are there announcements or any points of pride? Mr. Peretti?
I want to quickly go over the next step that we are getting into with our ad hoc committee. As you saw coming in this evening, there was a box of surveys, and right now, you know, as we were trying to really get out into the community and get everyone's interest, we have a very diverse community and want to make sure that we're hearing everybody's desires and needs and wants and what they see their schools providing. So this survey has been has taken a great deal of work by our staff, getting this thing where it needs to be, and we will start putting out into the community, to our libraries, to our faith-based organizations, to our ad hoc committee members who will be working to get the survey out to their constituency groups and getting as much of those sort of feelings and emotions, those intangibles sometimes, so that way we can sort of quantify it to a certain degree, but also keep in mind some of those things as well as we move forward and begin examining what we will be doing with our facilities going into the future, neighborhood by neighborhood. So if you would like, I would like everyone actually to grab one of these, get it filled out. If you do a paper version, they are due Friday the 11th. And we also have an online version on our website with all supporting information as well. But that one will be open until Monday morning, I think, the 14th. And we'll be taking all this information, analyzing it, and that'll help us get to our options phase of this master facility plan. Thank you.
Very good. Thank you, Mr. Peretti. Board Member Reyes?
Thank you, President Baker. So I was able to visit a couple of our schools this week. So I just wanted to thank Principal Angela Moore-Tyler from West Mound Elementary. I was sharing with Dr. Good. It's probably one of the most well-behaved schools I've seen. It was so quiet, and it was Friday, and I was thinking it was going to be nice and wild, but I did visit it. You know, as many of us know, they had some damage due to some vandalism at their school. So very happy to report that they didn't skip a beat. They just kept on going. They met. They handled it with pride, and our kids were not impacted. You know, they just kept on going, and they were getting ready for Dr. Seuss. So I know they're going to be looking for some Dr. Seuss readers. For those who are interested, I know that they're going to probably start soliciting probably some of the board members to come out and read some Dr. Seuss literature. I also was invited to South Mifflin with Principal Pamela Eberhart Horton to visit their Life Wax Museum. The students were actually live representatives of Black Cultural Month. So we had a little 12-year-old Obama with white hair. We had Aretha Franklin, who actually did sing. We had Michael Jackson, who refused to dance. He said without music. Even some of our special needs children were able to participate and were very excited. And I told them I would bend some ears at the board table and with Dr. Good to see if maybe some of them could come and perform their speech and show us their project. They were very inspiring. They memorized, they worked really, really hard, not only in their written presentation, but also in their oral presentation. So I would love to see if we can bring them to one of our board meetings to show off their talent. I was also with Board Member Brown and members of our staff at the Children's Hunger Alliance luncheon, and honored to be there as they recognized Columbus City Schools breakfast program. But also, if anyone has the opportunity to, I know they recorded the speaker, Liz Murray. She really had a inspirational story about being hungry, being homeless, being at that moment in life when you feel that it's you just want to give up. And she talked very profoundly about finding a mentor, finding someone to believe in her, and not only that, but being a child product of parents that were involved in drugs and eventually passed away because of the result of that, and eventually finding her path with a school, with a mentor, and getting her way to Harvard, and is graduated and is now getting her master's, and just that very low-key, very to the point with her message. And I think it'd be a great message for some of our children, our parents, and even our teachers to see. So if anyone has access to that, I think it's something that you should see. And if you've never seen I'm a Lifetime person, Lifetime movie of Homeless to Harvard, that is the young lady that story was based out of. So I would encourage you for that. Lastly, Children's Day is coming up. So Columbus City Schools Children's Day is April 30th. And I'm going to bunt it to Mrs. Gillison to kind of tell you a little bit about the locations and some of the times.
All right, thank you very much, President Baker, members of the board, Board Member Reyes. Yes, National Children's Day is coming up April 30th. Heart health, face painting, fitness, and performances, everything that you desire. Columbus City School on that day, the entire community is welcome to join us at any of the following locations for free games, refreshments, and fun for everyone. Centennial High School, East High School, Independence High School, Marion Franklin, Northland High School, and West High School. And this information will be up on our website with the times, and we are really excited. So all of the schools in that region, and those feeder schools will feed into the Centennial High School, East High School, Independence, Marion Franklin, Northland, and West High School. That's April 30th, and our National Children's Day begins at 10 o'clock, so you don't want to miss it because it's going to be fun for everyone.
And if you're interested in participating, we would ask you that you contact our offices.
If you are interested in participating in National Children's Day, please contact our office at 365-8950. Once again, 365-8950.
And when we're talking about participating, again, what we said, this is an event for everybody in our community. All are welcome. You don't have to be Columbus City Schools. I hope that you come and you see our schools, feel welcome, and understand that this is the right place for your children. If you have school-age children, we would love for them to come to our schools and experience what Columbus is all about. If you're a community partner, we'd also love for you to come and have contact with our community. So please look for more information on our websites. Thank you, Ms. Gillison.
Thank you.
Thank you, President
Thank you,
Baker.
Board Member Reyes. Board Member Brown?
Yes, thank you. Just a few things briefly, because I know the Children's Hunger Alliance program, the Menu of Hope, was already mentioned several times, and I fully endorse what's been said about the speaker. She was amazing, both in terms of content and also the way in which she told her story. It was a unique style that I'm not sure I've heard before, and it was really inspiring and wonderful to hear. So if you have a chance to read her book or read about her or to hear her, please do. Also, like some other board members, in connection with Black History Month, I too was invited and attended at Leawood Elementary School, where they had a wonderful living museum with students playing, various characters throughout history, and they were well prepared and polite and really nice kids. So that was good. I would suggest for the future that a few of them try to learn a little bit more about those folks. When I asked, for example, in music, none of the kids that did Fats Domino, Bessie Smith, Ella Fitzgerald, Count Basie, or even Louis Armstrong had listened to any of the music or had a clue who these great performers were. I know we're in a different time, and I know I'm, now an old guy, and it's not what they typically listen to, but it's an opportunity if you're going to study a little bit and present as if you're that person. It'd be great to at least encourage them to listen to some of the music or view some of the art about that character. And lastly, I did attend School Boards Association School Finance Workshop, a full-day workshop the other day, and it was a good refresher for me, filling in some blanks on what's happened from years ago to now, basically confirming that little has changed over the last 30, 40 years in school finance. But also, it did provide me a little bit of some things to think about and to be able to formulate new questions for Stan, and I'll look forward to that. And finally, 2 weeks from today is Election Day, primary election day in Ohio. It's incredibly important. Voting is already underway, early voting. You can go out and vote tomorrow. You can vote for lots of days, or you can wait until March 15th. But please do exercise your right to vote and encourage others to do so.
Thank you, Mr. Brown. Ms. Gibbs?
Yes. So just a few things. Number one, a big thank you to Buildings and Grounds for all that you continue to do for our facilities, behind the scenes, the things that you keep together and put together. We really do appreciate it. Next week, March 8th, is Innovation and Reform. Their meeting is at 6 o'clock at Columbus Downtown High School. Point of Pride, a big shout out to Pegging Cleary Shop and our vocational education department for 2 amazing open houses at our career centers, both at Fort Hays High School and Columbus Downtown High School. I had the privilege of joining President Baker and Vice President Cole. They were at Fort Hays earlier, but I caught up. I was going to culinary. So had a chance to see hundreds of families come out to find out what we have to offer. And it's a lot. Everything from, and you hear a lot about us talk about culinary, but you don't hear about our drafting, and our cosmetology department is state of the art. They are amazing. But we have our early childhood education department as well. And they had a crowd when I visited them because we are in the education business, and we do have a pathway to grow our own educators. And our early childhood education department does just that. And so it was just a great opportunity. Hats off to everyone who made that possible. Museum Day Live is Saturday, March 12th. If you're interested in your school or your performing group, your mime group, your friends, people to participate, I believe Commissioner Tykia Wright is still there, and I believe that email is museumdaylive614. Is that correct? museumday@AOL@gmail.com. museumdaylive614 and she'll answer your questions. And then finally, I'm going to say the word that I know teachers and students have been dying to hear: spring break. So can you tell me, spring break is a week, but slide can occur. So can you tell us what we have going on for spring break and what parents should begin to prepare for spring break?
Certainly. So spring break actually begins on a Friday, so it's more than a week this year. It begins on Friday, what some observe as Good Friday, and continues then that would be March 25th through April 1st, which is the following Friday. And then, of course, Saturday and Sunday, we won't have classes, but school resumes on Monday, April 4th. So the last day of classes is Thursday, March 24th, and we return to school then on Monday, April 4th.
Okay. And what is this? I hear about some reading blitz activity. Is that what I?
Yes, when our young people go on spring break, our teaching and learning department had put together a reading blitz opportunity for our young people that will run for 5 Saturdays. The first Saturday is actually on the 26th of March, and the 26th of March, March 30th, March 31st, and April 1st. Parents will receive practice materials to prepare students for the new assessment, and at 5 sites: Hilltop, 5 Columbus Metropolitan Library branches. Hilltop, South High, Hiltonia, Livingston, and Franklinton. There will be teachers there to assist with tutoring and helping our young people through those packets from 10 to 2, and to make sure we get as many students as possible, Columbus Metropolitan Library will hold a drawing, each one of the branches, for a Kindle Fire to be donated to the students. And if that's not enough, Cardinal Health is also donating 5 $50 gift cards for drawings at those 5 sites. So when you think about what are we going to do over spring break and how do we get our young people prepared, we're going to work with them over spring break to avoid that slippage. So 5 sites: Hiltonia, South High, Hilltop, Livingston, Franklinton. March 26th, March 30th, March 31st, and April 1st from 10 to 2, and there will be teachers on hand.
Wow.
And you can win a Kindle Fire or a $50 gift card.
Wow. Thank you so much for that. And then again, I want to echo my co-chair's endorsement and support. Please take these surveys for the Facilities Master Plan Ad Hoc Committee, take them to church, take them to book club, take them, I don't know if I wanted you to take them to wine club, but take them everywhere and ask 5 friends to fill them out. Just ask 5 people to fill them out. Send 5 friends a link on your Facebook, your Twitter, or your social media account, 5 family members, 5 parents, 5 neighbors, so that we can get the information we need to build the best facilities master plan possible. And that's all I have, President Baker. Thank you.
Board Member Gibbs. Ms. Hudson, did you have something else?
I do. Oh, I didn't do anything yet.
Oh, well, carry on.
Carry on. Thank you, President Baker. I have a couple things. First, last week, Audit and Accountability Committee met. We approved a calendar for the committee for activities through the year, so we'll be experimenting with that, as well as we did review the Office of Internal Audit's proposed budget, so that'll be coming through the FAC process. We heard a really great presentation on the close of the special ed audit from ODE. And President Baker, I'd recommend that a version of that be presented to the board. It was an outstanding presentation and, of course, very good news as well. So next month we had a robust discussion about the draft payroll audit, and next month will be the Auditor of State's report, and everyone teed up for a good report and some additional action steps after that. So our next meeting is March 24th at 3:30 up in the Cabinet Room. And so then I'll turn to, well, first, if anybody has any questions about A&A. If not, I'll turn to the Finance Committee. So we the budget process has begun. We heard a preliminary report at our last meeting, and so there's some, and then committee provided feedback. So there's been an awful lot of staff work that's gone into this, and we certainly appreciate the effort. There's the budget, it's both a budget for next fiscal year, but also it's really it's year one of a 5-year plan. And so what committee recommended was certainly that the board review the 5-year plan and some of those those larger functional issues, and that the committee will then review more of the numbers, the number moves, and ask questions such as which spend items might be better positioned in a capital versus a general fund budget, et cetera, to make those recommendations to the board. Is my understanding, do we have a meeting set for Monday?
Yes, we do.
Okay, so if,
I'll talk about that.
Okay, so there will be an opportunity for the board to review the plan prior to FAC. Then FAC will have its regular meeting next Thursday, which is the 10th at 3:30. It'll be here, and that will be an opportunity for review of that plan, and that will be more of a fiscal review, and they'll see the plan after the board has had a chance to have its first gander at it. So then, President Baker, I'll turn it back to you for the board portion of that.
All right, so thank you very much, colleagues, for all of those points of pride and announcements. So I do want to say that we will have a special meeting on Monday, March 7th, noon to 3 p.m. approximately. We will be talking about the district's budget, and so please do plan to attend. If you can't attend, please do let Mr. Benton know that. It should be a very interesting meeting as we see the presentation on the budget, the first part of the presentation. So last thing I wanted to share is Ms. Gillison and I last evening had a chance to present to the League of Women Voters and talked a lot about academic successes. And so I don't think earlier tonight we celebrated the academic successes. Ms. Gillison leads that part of the district, and so to see that sort of value added move from an F to an A is just absolutely amazing. And so I know everybody who's involved with that had a hand in it. Obviously, leadership is critically important with the superintendent and our chief academic officer. So Ms. Gillison and anybody else who's in the room who had any hand in that on the academic side of the house, please stand and be recognized. Thank you very much for your hard work continuing hard work on behalf of our students. Mr. Superintendent, would you like to add anything?
I would. Thank you, President Baker. I think we need to recognize as well, the district certainly received that award at that wonderful Children's Hunger Alliance event yesterday, but it's due in great part to the efforts of Joe Brown, who oversees all of our food services operations. So, Joe, I think you should stand and we should recognize you. Joe will be serving sloppy joes after the meeting this evening. I did think, and absolutely, Liz Murray is definitely one not to be missed. To get online, watch her presentation, stunning, absolutely stunning. But what was really exciting to me for Columbus City Schools is there was only time for one question that one of the hosts posed to her at the end, and they said, "What's one thing that everyone can and should do?" And Liz very quickly replied, "Be a mentor." It's the single most important thing in anyone's life. And I thought how rewarding it is to be in a district where a board has made the commitment and the investment in securing a mentor for every child. And we had the wonderful leadership of Dr. Keisha Hunley Jenkins and her team championing that in collaboration with Ms. Ward. And so very, very exciting news and certainly very timely. Second thing is, yes, if you want to read to students this week, just let JC know. He'll get you out to a building. We'll even provide you with books. It's one of the best things you get to do. This morning I had the opportunity to go to one of our sites we don't often consider a site. It's the Franklin County Board of Developmental Disabilities Early Childhood Education and Family Center over on Johnstown Road, and we actually have 3 classrooms there. And so I got to be entertained. I don't think I did the entertaining. I think they entertained me more than I did them with my reading, but our preschool and kindergarten inclusion classrooms there. And Ms. Gillis and I will be heading over to Broadley tomorrow, and there's just a long list of opportunities for anyone that wishes to read, and the children love it. They, for some reason, think I'm the President of the United States, so if you attend, we'll say you're part of the Supreme Court. How's that? And they don't know any better. It's okay. Actually, they do know better. I'm kind of surprised they didn't know about the music, because they do study hard, all of those things. But quite honestly, I'm not certain I know some of those individuals you named or their music, so I guess my bad, huh? A couple of events that are coming up. April 16th, it's a Saturday at East High School at 9:30 a.m. We will have the pre-kindergarten fair, and it's been a real joy for me to be able to work in collaboration with the city and Director Johnson on looking at how we can expand access to high-quality pre-kindergarten experiences for all the city's 4-year-olds. And I know that you're familiar with the initiative we're embarking on jointly with many other partners as well at the Linden Park setting. And but this preschool fair, you'll hear more about it at the next meeting. We pledge to present that. And then if you're not a preschooler, you're a little bit older and it's time for kindergarten, we have our countdown to kindergarten on May 14th. That'll be out at Fort Hays again, and that's an event not to be missed. Everyone that's a provider in the city, whether it's nonprofit or government services. Even last year, I think I told you it was amazing. A SWAT team that was rehearsing out at Fort Hays for 2 weeks and wouldn't tell us a single thing about what they were doing, saw all the excitement of 2,000 people at the pre-kindergarten roundup and set up a table, and we're sharing shells and weapons with children. but it was so wonderful because as the children arrived, their first stop was with the police officers, Columbus Police Department, and they got to play in the cruisers and get deputy stickers and begin to build that relationship that's so critical with our public service officers and public safety officers. And you know that could sustain safety and security and a positive relationship through a lifetime. So it's hard to describe how exciting that event is, but you'll be remiss if you're available not to attend on Saturday, May 14th. And then, of course, on the 30th, Children's Day, and Alicia has already shared so much about that. But again, it's another opportunity for our children to really showcase all that they're about and their literacies in more than just reading and numeracy, but in visual and auditory and kinesthetic arts and social sciences. So please consider attending that. Just a couple of dates, because I know Ms. Gibbs will ask. The elementary and middle school applications for school choice are due on March 31st. So elementary and middle school applications, and those that wish to return to their home school from a lottery placement or selective placement, those are due on March 18th. So you have a couple of weeks still to have that dialogue with your families and make those decisions. And then lastly, I don't want to leave out business and operations. And there's a wonderful event that's going to occur later this week. I'm going to ask our Chief Operating Officer, Maurice Oldham, to speak to the outreach event.
Thank you, Dr. Good. President Baker, Vice President Cole, members of the board, I'd like to announce that on Friday, March 4th, in Business Operation, we will have an outreach event with the theme of Best of Business, a Better Way of Doing Business. This event will be from 1 p.m. to 4 p.m. at Hudson Distribution Center. And the intent of this event is to meet our new director of Buildings and Ground, DeJuan Hood, as well as our outreach coordinator. And this event is planned. It's from 1 to 4. We have a lot of outline in our events. We're going to talk about insurance practices with the district. We're going to talk about ways to do business moving forward. We're going to talk about opportunities for next fiscal year. So we're very excited about this event. I do want to recognize Director Hood as well as Terry Wise for reaching out and putting this event together. And I'm very excited and look forward for this event on Friday. That's on March 4th, 1 to 4 p.m. at our Hudson Distribution Center, and it will be in the library at that site. Okay, thank you.
Thank you, Mr. Oldham. All right, thank you very much. Since we did just have the State of the City address at one of our schools, I'd like to ask Director Johnson if she'd like to share any words of wisdom this evening.
Thank you, President Baker. I don't think I have any more words of wisdom, but I am very pleased that the mayor announced in his State of the City address the partnership with Columbus City Schools. And I just wanted to go on the record here, and all of you know that there was some errors in the article that appeared in the dispatch about who our partners were. And I want to make sure that people understand that the partnership is between the City of Columbus and Columbus City Schools.
Thank you, Director Johnson. All right, Ms. Gibbs.
Yes, just one more. And to Director Johnson, a big thanks in the same theme of Women's History Month and our extreme pride of having our alumni, Mayor Ginther, lead the city. He has announced the City of Columbus Commission on Women, and they are about to put together an organization and a commission. So if you would share our thanks for him for understanding, in his words, the balance as we have invested in saving young men and boys. It's also important to save young women and girls. And he has launched a women's commission with Nicole Dunn from the Women's Fund and First Lady Shannon Ginther. And so I'd like to express our thanks in making sure as our mission is that each student is highly educated, that he sees the value in all students and young people, both male and female.
Thank you. If there's nothing else for the good of the order this evening, the chair will entertain a motion to adjourn.
Move we adjourn.
Second.
Moved and seconded. Mr. Treasurer?
Vice President Cole.
Yes.
Ms. Gibbs.
Yes.
Ms. Hudson.
Yes.
Mr. Peretti.
Yes.
Ms. Reyes.
Yes.
President Baker.
Yes.
Mr. Brown.
Yes.
The motion carried.
Thank you. We stand adjourned. Thank you for being here this evening. Drive safely.